Hi, my name is Faisil Syed. I am the Digital Technology Manager for SEHA Abu Dhabi Health Services, part of Pure Health. My role is to introduce new technologies in SEHA and offering it to our healthcare facilities the best of the technologies for patient-facing and treatment purposes. We've worked a lot during pandemic. We have brought in IoTs, wearables, we've brought in robotic process automation, we've brought in AI, machine learning related technologies to actually help out our patients. The biggest beneficiary we have actually had is from the cloud infrastructure. We've got a very hybrid cloud infrastructure that we built prior to COVID, which allowed us to actually expand during pandemic time. During pandemic time, the National Health Services of Abu Dhabi actually provided full screening to entire UAE infrastructure with 38 screening centers in the entire country, being connected to one data center, one data farm, where all of the data was being processed through different labs where the results were coming through, and we were actually sending the results to our patients across the country. Post-pandemic, there has been a lot of changes coming into the Abu Dhabi healthcare landscape. There is obviously merger and acquisitions happening at various different organizational level. There's stuff that obviously has happened in the Pure Health space and obviously in Mubadala Health space, which is public and openly available information from the media itself. What we are actually looking in terms of providing is the opportunities for collaboration. So when more and more hospitals are actually joining our group, we're looking to actually provide the same set of services that we actually provide in our core SEHA facilities. We tend to actually provide the same, we offer the same opportunities to our other hospitals who are actually joining us. Our most recent go live has been actually at Silvan Hospital, which is a childcare specialist hospital with long-term care ability, and we are actually providing the same set of EMR and the number of other technologies that we operate within. We are actually trying to provide the same level of technologies to these new healthcare facilities as well, to basically maximize the scale of operations, and that actually brings down the cost of operations down as well, along with improving the skills and the capabilities of all of these IT and clinical support that's actually working with the patient record throughout our group. The best way we will actually accelerate going in the future is to actually move from legacy systems into a much more agile cloud-based implementation. What this means is that as healthcare, we focus on providing healthcare towards our patient, having more and more healthcare specialties and service lines being opened up, and not to worry about the scalability of the IT operations. IT operations should be actually kept in the cloud level, whereas a number of entities you can actually open it up and you can have n number of users actually using the services. But the focus of IT is to enable patient care related technologies, whether it is IoTs, whether it is mobile wearables, whether it is to do with mobile health provisions, telepresence, telemedicine, and other sort of technologies that will actually improve the patient-physician relationship. I think we will be focusing over there. But to enable that, a cloud infrastructure is very important, because this is the best way of actually making all of these facilities available without the need of dependency on heavy data centers that would actually be required. The new age solutions that we are actually looking forward to is actually much more geared towards actually dealing with disease management. So for example, if we're talking about diabetes, if we're talking about stroke, if we're talking about mental health prevention, and a number of other diseases, hypertension, we need to focus on these particular set of diseases and help patients actually not actually have their situations aggravated to a bad state where they're actually having to actually suffer consequences as a result of bad health. So what I'm trying to say is, if somebody's got diabetes, we don't want it to get deteriorated to a particular point where they actually go on to insulin and some more extra healthcare, or somebody who's got a blood pressure or a hypertensive condition, not to actually get to a point where they actually suffer a heart attack. The longer we can actually prolong these problems and give the notion of longevity. Longevity is the key word over here, that we're trying to actually give a better lifestyle to our public who are actually getting our health services. They should be able to actually get our health services without the worry that am I actually going to get access to my record, or where am I going to get the medication from, or where am I going to actually get the physician services from. They should be able to come in the entire group and have the same record and same details being available, and maximize the treatment that they actually receive, they should be able to receive it as a standard treatment throughout the group. So we are focusing, more of our efforts are actually towards improving our HIS system, our Oracle Fusion system that we're actually bringing in, and a number of other technologies which has to do with AI, machine learning and RPA. We've already been on the journey towards RPA. We've implemented more than 60 bots that are actually working on different workflows, automating stuff within SEHA enterprises, and we're looking to actually expand that across the entire group.